Hey everyone! Today, we're diving into a crucial topic often surrounded by whispers and misinformation: sexually transmitted infections, or STIs. STIs are more common than you might think, affecting millions globally each year. Despite their prevalence, stigma and confusion persist, making it hard to get the facts straight. Let's break down the most common STIs, their symptoms, transmission, and how to protect yourself. Let's start with HIV, the human immunodeficiency virus. HIV targets the immune system, and if untreated, can lead to AIDS-acquired immunodeficiency syndrome. Thanks to antiretroviral therapy, ART, people with HIV can live long, healthy lives. HIV spreads through certain bodily fluids like blood, semen, and vaginal fluids, often via unprotected sex or sharing needles. Many people don't experience symptoms for years, making regular testing crucial. A simple blood test or oral swab can determine your status. With consistent ART, HIV can become undetectable and untransmittable. Prevention includes using condoms, regular testing, and considering PrEP, pre-exposure prophylaxis, if at higher risk. PrEP significantly reduces the chances of contracting HIV. Knowledge and proactive measures are key to managing and preventing HIV. Next, let's talk about HPV, or human papillomavirus. HPV is a group of over 100 viruses, and almost everyone sexually active will get some type of HPV in their lifetime. Some types cause genital warts, while others are linked to cancers like cervical and throat cancer. Most HPV infections clear up on their own without causing health problems. HPV spreads through skin-to-skin contact during sex, and while condoms reduce risk, they don't eliminate it entirely. Regular screenings like pap smears for women are crucial for early detection. There's no routine HPV test for men, but the HPV vaccine is highly effective in preventing the most harmful types. The vaccine is recommended for all adolescents and can be given up to age 26, and in some cases up to age 45. Genital warts can be treated, and early detection of precancerous cells can prevent cancer. Vaccination and regular screenings are your best defense against HPV. Chlamydia is another common bacterial STI, especially among young people under 25. Often called the silent infection, many people, especially women, don't experience symptoms. Chlamydia spreads through unprotected vaginal, anal, or oral sex. Symptoms, if they appear, include pain during urination, abnormal discharge, and pain during sex. A simple urine test or swab can diagnose chlamydia, and it's easily treated with antibiotics. It's crucial to complete the full course of antibiotics to prevent recurrence or resistance. Untreated chlamydia can lead to serious complications like pelvic inflammatory disease, PID, in women. PID can cause chronic pain, infertility, and ectopic pregnancy. Prevent chlamydia by using condoms consistently, getting tested regularly, and encouraging partners to get tested. Open communication about sexual health is key. Syphilis is a bacterial STI with serious health consequences if untreated. It progresses through stages, each with distinct symptoms and risks. Syphilis spreads through direct contact with a sore during sex or from mother to baby. Primary syphilis involves a painless sore, or chancre, at the infection site. Secondary syphilis includes a rash, fever, swollen glands, and fatigue. Without treatment, syphilis enters a latent stage with no symptoms, but can cause severe internal damage. Tertiary syphilis can occur years later, causing life-threatening damage to organs. Syphilis is curable with antibiotics, especially penicillin. Early diagnosis and treatment are crucial for a better outcome. Protect yourself by using condoms, avoiding contact with sores, and getting tested regularly. Gonorrhea is a bacterial STI that's becoming increasingly resistant to antibiotics. It affects the genitals, rectum, and throat, spreading through sexual contact. Symptoms vary. Men often experience painful urination and discharge, while women might have mild or no symptoms. Untreated gonorrhea can cause serious health issues like pelvic inflammatory disease, PID, in women. Diagnosis involves a urine test or swab, and treatment requires antibiotics. Complete the full course of medication to prevent resistance. Prevent gonorrhea by using condoms, getting tested regularly, and discussing sexual health with partners. Herpes is a common viral infection caused by the herpes simplex virus, HSV. There are two types, HSV-1, which usually causes oral herpes, and HSV-2, which typically causes genital herpes. Herpes spreads through skin-to-skin contact during sex, even without visible sores. Symptoms include painful blisters or sores, itching and tingling, but many people have no symptoms. There's no cure, but antiviral medications can manage outbreaks and reduce transmission risk. Diagnosis involves a physical exam, swab, or blood test. Prevent herpes by using condoms, avoiding contact during outbreaks, and discussing herpes status with partners. Daily antiviral medication can reduce transmission risk if you have herpes. Open communication and precautions are essential for managing herpes. Stay informed and proactive about your sexual health. Trichomoniasis, or trich, is a common STI caused by a parasite. Many people, especially men, don't experience symptoms. Trich spreads through vaginal sex and is more common in women. Symptoms in women include itching, burning, pain during urination or sex, and a frothy discharge. Men might experience mild symptoms or none at all. Diagnosis involves examining a sample of vaginal fluid or a lab test. Treatment is a single dose of antibiotics, and both partners should be treated to prevent reinfection, prevent trich by using condoms, getting tested regularly, and discussing sexual health with partners. Regular STI testing is crucial because many STIs don't cause noticeable symptoms. You could have an STI and not know it, potentially transmitting it to partners. Regular testing is the only way to know your status. Think of it as preventative care, like a dental checkup. Talking about sexual health and getting tested can feel awkward, but it's essential. Your doctor is there to support you and answer questions. Early detection allows for timely treatment and prevents long-term complications. Make STI testing a regular part of your healthcare routine. It's one of the most important things you can do for your health and your partners. Stay informed, stay healthy, and take control of your sexual health. That's it for today's video on common STIs. Remember, STIs are common but preventable, treatable, and manageable. Talk to your doctor, get tested regularly, and have open conversations with partners about sexual health.